Next, so under the enteral category, we have seen oral, sublingual, buccal, and rectal routes. Now let us see the parenteral route. Parenteral is the one that bypasses the digestive tract or the alimentary canal. Now you can see here in the picture it is shown that how it is, mostly it is given in the form of an injection. The injection can be intravenous, the injection can be intramuscular, it can also be subcutaneous. Intravenous, as the name itself indicates, drug is directly introduced into the veins. This is one particular route that has 100% bioavailability of the drug. If you want to deliver a precise dose of drug to a particular site, the best route is to introduce the drug intravenously. Now we also know that intravenous medication is also given in the form of drip. They put they say saline, glucose. They put it in the form of a drip and also administer it. Both the routes are intravenous. It can be given in the form of an injection. It can be given in the form of an infusion. It is called infusion and injection. Intramuscular is giving the injection to the muscle. Muscle is where you have a lot of muscle like thighs, like upper arm, like hips. There it is given in the form of an injection. Then subcutaneous means just under the skin. The drug is introduced just under the skin in the adipose tissue. Then there is another form of injection that is called as intrathecal. Intrathecal is, maybe you do not know, intrathecal injection refers to injecting the drug in between the vertebrae in the spinal cord. In between the vertebrae, a fine needle is introduced, and through that needle, the drug is introduced directly into the central nervous system. It will have instantaneous effect. So this is the parenteral route. Now let us see each one of these routes separately. You can see here a long needle for intramuscular and an IV needle directly into the blood vessel, and the subcutaneous is a small needle and the drug is released right beneath the skin. See, you can see here, this is the injection and this is the infusion. See, you can see it's an IV drip and this is the injection. In both the methods, the drug is introduced into the bloodstream directly. There is little risk here. Effects as well as side effects start instantaneously. Fine, if it is working nicely and if the intended action is delivered immediately, it is good, but side effects also will start almost instantaneously. So for administering the drug as well as for monitoring the situation after drug administration, expert vigilance is required. Rapid absorption and rapid action, no first pass effect. Whatever concentration you want to give, you can give nicely without any fear that some concentration might be lost or some drug will be lost due to first pass effect. So there's no first pass effect, there's no risk of vomiting, 100% bioavailability, but it is invasive. Invasive means a cut need or a small incision need or a small for injecting the needle. It is invasive. Risk of clot formation is there. If the person who is giving the injection is not an expert, then you will get clotting. Clot formation risk is there. And another disadvantage is that only liquid form of the drug can be given. It is expensive. You take the medicine by yourself, that is the cheapest route. But if you need someone else assistance to do it, you also have to pay the person. So it is expensive, requirement of skill, and it is little painful, it is less safe, and there can be a risk of infection also in this particular mode of drug delivery. Let us see another parenteral route is intramuscular injection. You can see here a long needle is introduced into the upper arm muscle. See, at 90 degrees the needle is introduced. Long needles are needed because muscle is present beneath the adipose tissue. Adipose tissue is present beneath the skin. Beneath the adipose tissue you have the muscle. So long needles are introduced at 90-degree angle and the drug is released into the muscle. Now this drug at this route, the drug absorption will be little late. Intravenous means directly into the blood, Now this, but from the muscle it has to diffuse into the blood capillaries, and through the fine blood capillaries it will have to reach bigger capillaries. From there the circulation will start. So effects and side effects take little time. It is slow absorption, no first pass effect, no risk of vomiting. It is also invasive, expensive, and there is also risk of infection in this particular mode. Next, another parenteral route is subcutaneous. If you have elders in your family, your grandparents, you must have seen them administering insulin through the abdomen or some place, where there is fat. Simply through a small needle, the drug is introduced right beneath the skin. Beneath the skin where there is lot of fat. Into the fat, the drug is released. Since adipose tissue will have little blood circulation, the particular drug will take some time. Slowly, slowly it will diffuse into the blood, and slowly it will start its action. So large protein based drug molecules that are likely to be hydrolyzed by digestive juices are mostly taken through the subcutaneous route. Why? Because if the pill is swallowed, large molecules, especially protein molecules, they will be hydrolyzed by the digestive juices that are there in the abdomen. So this particular route is preferred for large molecules, especially insulin is taken through the subcutaneous route. Even some other medicines also, in our childhood, some of us got vaccination. The vaccination drug is also released right beneath the skin. So slow absorption, no first pass effect, and no risk of vomiting. It is expensive because if a person does it to himself, it is less expensive. But even then, they have to purchase the needles and the whole setup. It is little expensive, and small pain also will be there, and there is a risk of infection also in this route. Now, what is intrathecal route? Intrathecal route, as I told you, is giving the drug to a particular region in between the vertebrae. So you can see here, this is the spinal cord, and in the vertebral column, not even nurses, only doctors give this kind of injection. They need to be specially trained, because it's a way instantaneously, because you are dealing with the central nervous system. Effect will start almost instantaneously. So this intrathecal injection is given only by doctors. By carefully they will measure the vertebrae, they will choose the particular location, and in that location they will administer the drug with a fine needle. So it is given to the spinal canal, and rapid local effects. This particular drug, once it is introduced into the nervous system, it will mostly cause local effects. Local anesthesia when people are undergoing surgery to some part in the body, some abdominal or some gynec surgeries and all. This kind of injection is given. No first pass effect, no risk of vomiting. Trained and skillful personnel are very much required, otherwise it will be a disaster. The person has to be exceptionally skilled as well as trained. Only liquid form of drugs can be introduced. As I already told you, the whole of parenteral route, they will always give only liquid form of the drug. Even intramuscular also, hardly it can be, the liquid can be little thick, but only liquid form of drugs can be introduced. It is expensive as well as less safe. Now, let us look at the other routes. So far, we have seen the enteral route, which involves the gastrointestinal tract. We have seen the parenteral route that bypasses the gastrointestinal tract. And now, let us see the other routes. You can see here a drug is being administered into the eye. Here you can see a drug is being given to the ear, and here you can see a drug is being given through the nose. The drug, if it is introduced through the eye, the route is called as the ocular route. If the drug is introduced through the external ear in the form of drops, then it is called as the otic route. And if a drug is introduced through the nose, it is the nasal route. We know very well eye drops if we get eye infection, or if a person undergoes surgery in the eye for cataract or related issues, then eye drops are given to the particular person directly into the eye by pulling the lower lid down. You can see here how the lower lid is pulled down and the drops are placed in the pouch. Then the drops are introduced either in the form of a liquid or a gel or an ointment, or sometimes solid inserts are also placed in the correct location. And the absorption of the drug takes place through the conjunctiva or the cornea of the ear. This particular route is adopted for treatment of eye infections, for pupil dilation. Supposing you are having some problem with your vision, you are getting frequent headaches, or you are not able to see the blackboard from a distance, then you approach an eye specialist. The ophthalmologist will have to dilate your pupil and also see, in which case he will put some drops in the eye, and then it will dilate the pupil such that he'll be able to see behind whatever is there, clearly he can see. So, treatment of glaucoma, infection, for pupil dilation, drugs are introduced directly into the eye. But the problem with this route is that there would be instant runaway. The moment you put your lid down, like this, they will hold the lid like this for some time and then put the drop. The moment they release, you put your lid down and the drop will be instant runaway will be noticed. And there will also be another disadvantage. There can be temporary blurring for a few hours, so blurring of vision. Side effects are rare, but if at all we get some side effect, it is because of absorption of the drug into the blood. For some people there can be some intolerance, then they will notice some side effects due to entry of the drug into the blood. Then otic is for ear infections, for ear problems, and only liquid form of the drug is introduced into the outer ear. Sometimes, kids, small children, they will have severe ear pain. Some person is suffering from sinus problem, then also there will be earache. So for the pain relief, for introducing an antibiotic if there is some infection in the ear, for such reasons drugs are given into the eye in the form of drops only to the external ear. From there slowly the drug will move into the inner ear canal. Nasal route is where the drug is given through the nose. Now when you are having some, your nose is blocked or you're unable to breathe freely, and some sinus issues, in that case they will ask you to spray some drug through the nose, like that, then it is called nasal inhalation. But inhalation is mostly through the mouth. Some person is having some asthma problem, then they will bronchodilator drug will be given for inhalation through the mouth. Mechanically they will press it like that and the drug will be delivered into the mouth, from the mouth into the windpipe, from the windpipe into the lungs. Now, absorption of this nasally or orally inhaled drugs, drugs if they are inhaled through the mouth, the extent they are absorbed or the level of absorption will depend on how fine the drug is present, or the fine droplets, the finer the droplets, or the finer the small, it will be like vapor, it will be like some vapor, some mist, it will be introduced in the form of mist or vapor. The finer the droplet size, the more it will travel into the windpipe and into the lungs, where it will be absorbed. The effect will be depending on how fine the droplets are. So aerosolized drug is introduced in the form of droplets, and it will interact or it will reach the mucous membrane lining the respiratory tract, and through the blood vessels that line the mucous membrane, this drug is entering the blood, where it will cause the effect that is expected from it. Even anesthesia also sometimes is given in the form of in the form of an inhaled drug. It is inhaled. Nebulized also. Nebulizer is if the volume of drug or the quantum of drug that needs to be introduced is more for a longer period of time, then it is an automatic machine, it is connected to power supply, and it will convert the drug, liquid form of drug, into fine mist, fine vapor, and there will be some carrier liquid also, so that it will carry the drug into the respiratory system through the mouth. It will go into the tract, from there it will go into the lungs, and it will cause the desired effect through nebulization. Also, there is little risk here. If the drug is directly deposited on the lung wall without becoming a fine mist, then it will cause irritation, it will cause coughing, wheezing. Little care is required. Some skilled person has to do it if he is doing it by himself, or some health assistance is required. Then we move on to the next route in the other routes category. Other routes category, we know the cutaneous route and the transdermal route. If the drug is introduced in the form of an ointment on the skin, it is the cutaneous route. Transdermal route is little different. Cutaneous route is for local or topical action. You're having headache, you apply the balm here. You're having some leg pain, you apply the balm there. Wherever it is applied, there only it will act. That is the cutaneous route. But the transdermal route is the drug is introduced in the form of a patch. A patch which is impregnated with the drug is pasted on the skin. Slowly, it is also mixed with some alcohol or some substance that can penetrate the skin. It will penetrate the skin. It will come in contact with the blood vessels that are lining the skin, and through the blood vessels, slowly and uniformly the drug travels throughout the body. The cutaneous route is only local application and local effect, but the transdermal route, where the drug is introduced in the form of a patch, is slow, but it is continuous. Action will be felt throughout the body, but this particular route can also cause some irritation. Penetration is very low. Somebody is really sick, some palliative care is required. Unbearable pain is there for the person. In case he has to be given some palliative care in the form of pain relief, then these transdermal patches are introduced. Slowly the pain relief will occur. Or with some long term, it will last. If they put the patch today, the patch effect of the patch will last for 2 3 days. Again they will change the patch. So fentanyl for pain relief, and scopolamine as a laxative are given in the transdermal route. Next is the vaginal route, where the drug is introduced through the vagina in the form of a gel, tablet, vaginal ring, suppository, or a film. All these are the modes. In fact, vaginal route is the route, but the drug can be given either as a gel or a tablet or a ring or a suppository. Good. And its slow absorption will be there, and through the vaginal wall the absorption will occur. So for treating infections, or for causing contraception, or for treatment of gynecological problems, and for providing estrogen supplements in women who are in the stage of a menopause, when their estrogen levels are abnormally low, then estrogen supplements are also given to women through the vaginal route. Now you can see broadly here the various all are submitted here. The image is taken from Google. So you can see the oral route as an oral suspension pill, and you can see the IV route, where the drug is introduced in the form of an intravenous infusion. You can see the intramuscular route, where the drug is introduced into the muscle at 90-degree angle with the help of a long needle. The subcutaneous route, where the drug is introduced right beneath the skin. The intradermal route, just beneath the skin, and intradermal means through the skin. Then inhalation, as I was referring, the nasal route. After the nasal route, we learned about inhalation. If people are having some problem, allergy problem, or some, the congestion in the respiratory tract, breathlessness, then this they can inhale they can use it by themselves manually and mechanically, and the drug can be inhaled through the mouth. Sublingual route, where the drug is placed beneath the tongue, is an SOS drug for heart attack. The rectal route, where the drug is introduced in the form of a suppository into the rectum. Then the topical route, ointments, gels, sprays, they are all topical. Otic route, where the drug is introduced into the external ear. And ophthalmic or ocular route, where the drug is given to the eye. So these are all the various modes or routes through which the drug is administered. We come to the last part of the chapter, is 5 rights for effective drug administration result. If you want the proper result, or the effectiveness of drug administration depends on 5 rights. Right things, 5 rights. The right patient, the drug should be given to the right patient, the one who deserves it. The right patient, the right drug. You can't give one drug in place of another drug. Suppose somebody is having fever, he should be given only paracetamol. He should not be given some antibiotic or something else, to just reduce fever. For reducing fever, only antipyretic drugs should be given. For killing infection, for minimizing infection, antibiotics have to be given. So the right patient, right drug, right time, suppose you have there will be, you're asked to take the drug after every 8 hours, after every 6 hours, or in times of pain. Only at the right time it has to be taken, in the right dose. How much the doctor prescribes, only that dosage needs to be taken. And finally, the drug effectiveness depends on the right route. If the drug is to be injected, only injection has to be taken. If the drug is to be taken in the form of drops, the drops in the eye or ear or inhaled, only in the right route it has to be introduced. So effectiveness of the drug will depend on the rightness of the patient, how deserving the patient is for the particular drug, right time, right dose, and the right route. So, finally, what have we learned in this chapter? In a nutshell, we have learned that drug administration basically means introducing the drug into the body of a person. Then we have seen choice of route depends on the drug, properties of the drug, depends on the complaint, like where it has to act, and also on the condition of the patient. So, choice of route is controlled by drug factors, aspects related to the complaint, as well as the patient. Then we have seen the mode or site of drug administration can be enteral, parenteral, and also other routes. And we have seen enteral is alimentary canal. Enteral route definitely involves alimentary canal or the gastrointestinal tract. Parenteral route bypasses the gastrointestinal tract, and other routes are mostly for local effects. Then we have seen what the 5 R's are. We have just now seen right patient, right dose, right time, right drug, and the right route. Thank you.